You got diagnosed at what, 29?
So then official diagnosis was at 30.
Yeah.
And then I was with the great team, then with a bad team, but they did me a favor because it made me realize how lucky I have been because I haven't had that stigma.
Yeah.
And it's made me very vocal about my diagnosis since then because
people get like that. You get to how do you find people react to it? Because I mean, you're like the top. You know, like I mean, not to kind of put the pressure on, but if you fuck up, you know, like, it has serious consequences. Whereas if I fuck up, it's just a typo, or you know, if someone tries to sue us.
But before we continue, did we actually break down what it is you actually do?
Oh yeah, big one.
Sorry. Oh yeah, sorry.
It's always the context is king. Context is king.
So I'm a doctor, and I am. I'm a surgeon. Yeah, but it's from one to the next. Doctor, surgeon.
A little bit of both.
No, well,
how does it work?
Graduated as a doctor, then you become a surgeon. I did my exams. And I am specialising in urology, not neurology, urology.
Urology is
and is that for both men and women?
Yeah.
You must have seen a lot of dicks.
Yeah.
Tell us about the dicks. What constitutes as a fine penis?
Oh no.
Oh yeah, that's right. We were holding back. We want to know. Go on, lads. Get it.
No.
So a couple years ago. You have to
get that personal, mate. I mean, come on. A couple of years ago, know about that one.
No, a couple of years ago, I went to a urologist for.
We flopped out the guy who mistook it for an anaconda. Dude, that thing's like Thor's hammer. It just swings like a pendulum.
I feel like I'm red.
They call it Big Ben for a reason.
Oh no.
He's never seen it in his life.
No.
Have you ever seen his wife without a smile on her face?
Yeah, he's a good friend.
It's what he imagined it to be.
Honestly, it looks like this.
I don't know why you spend.
Yeah, why are you imagining this?
Yeah.
I mean, it's the most interesting thing about you, Marlon.
It's not that
interesting.
2 years ago, Marlon.
Yeah, so 2 years ago, I went to a urologist for suspected kidney stones.
Oh yeah.
So I had to go there. You had to do this whole thing where you fill up your bladder, start drinking like a litre of water and everything.
Okay.
And you do like I guess it's some sort of ultrasound.
Did they do an ultrasound?
Yeah.
Okay.
And it was it's just interesting doing that. It's a scary process as a man to go through that.
Yeah.
So just want to talk to you how do men handle that process when they come to see you?
You know what, it's interesting because it's urology covers kidneys, bladders, prostates, penises, testicles.
So many questions about the prostate thing, but yes, go on.
But it's interesting getting some of the younger sort of teenage boys or even 20s and 30s
when you're like, all right, let's
when you have to examine them, but that's understandable. And do you
ever quietly mention to people who are nervous, like, oh wow, that is big, or something like that?
That would
make me feel so much better
I'm
if a doctor said, medically speaking, you have a fantastic penis.
No, but the thing is, though, when you go to
a doctor, professional.
I had that once.
When you go to a doctor, you get stage fright. You get
and it's so understandable.
It jumps back inside of you.
You're just like it's like come on, boy.
I have had comments I'm nervous and
I'm nervous. Yeah, we know.
The thing is,
sitting there and it's like tiny wee.
Oh no!
You're like fuck, man. I swear.
It's a very weird thing.
And you ask for extra large condoms afterwards. They're like, yeah, sure, mate. Go on then. They start at extra large for fuck's sake.
It climbs back inside of you.
Yeah, and that's the worst bit when you ask for the condoms beforehand, and you're like, I'm
we don't give out condoms. We're not a gum service. We're not a gum service.
All right, we're moving forward. All right, okay, sorry.
It's a lot of people will say I'm really nervous in hospitals, and usually my answer is that's totally normal. We're the weird ones.
There. Fuck off.
Yeah, we're the weird ones that enjoy being in hospitals, so that's understandable. And men are less likely to turn up to hospital as well, so give them kudos for coming.
Yeah.
And
sorry.
Oh gosh, yeah. lots of
everything's
jokes.
a euphemism.
Oh yeah.
Okay, go on.
And
kudos for coming.
it's I think it's as with any specialty, everyone's a bit scared coming into hospital.
Yeah.
Being a patient myself,
it's scary to even admit that you're ill.
Yeah. I get scared going to hospital.
No one wants to be
especially with any problem with your
if it's
down there as a man. It's very scary. You feel like you're gonna die immediately.
Yeah.
And
honestly, sometimes it's just take the leg.
Yeah. And for me, I didn't necessarily know it was a suspected kidney stone, but to me, I felt like I was gonna die.
Yeah, I bet it did.
Yeah.
Because it's like, because all of a sudden you go from being normal to like, what the fuck's wrong? I had food poisoning the other day. I couldn't cope.
Yeah.
I was like,
It's scary when it comes to your health
Yeah.
because it's something that seems to be out of your control.
Yeah.
It's like my little cancer scare that I was telling you about earlier.
I was like,
mate, an entire evening, I gave up everything for a whole 12 hours.
When I went,
I didn't even vape.
When I went to the urologist, I was like, I know my kidneys are failing.
Yeah.
And I kept having that feeling.
It's terrifying.
But it turned out to be nothing. But just going.
Yeah.
And
Same.
it's scary. And I've been on the other side of it. I've been a patient and had my
Have
own.
you? What's that like going into? Did you have to go to your own hospital? 'Cause
Wait.
presumably
I
you
had
would.
my own team investigating me.
Fucking hell. That must be awkward.
Urology. I can't remember now.
That must be weird because then, like, you know that, like, the boss has seen your vagina.
Yeah.
So
She was lovely about it.
Did you make any eye contact for how long before you started making eye contact again? or
It was
were you just
fine.
like, please stop looking
No.
Couldn't
quick
you just have a
question:
look at yourself
did you
and sort it
critique their technique because you're a professional
Yeah.
as well?
No,
you
she
know,
was
And
great.
then you're like, you know what you're doing. You're probably good at your job and everything. So
If
you're
I was-
like,
if I was
hold
in
on,
your position-
I know I can do this myself. What are you doing now?
Yeah. Like,
Oh no, but she's
Give me a damn
the
mirror.
boss. She knows
Right.
what she's doing.
Right.
Yeah,
She
he's
knows
like,
what
Sally,
she's-
you got cold hands, you bitch.
You know.
And if you tell anyone,
She knew what she was doing.
yeah, you get called lightning bolt for the rest of your career.
But I think in some ways having that experience of being the patient makes you more empathetic.
Yeah. Does it make you a
for
better
your
doctor?
patients. I think so. I think so because you understand a little bit more of the fear and actually going through some
I
investigations.
think that stage fright. I mean, we were just talking about stage fright there, but I mean, like, if it's
I've
my
got stage
boss
fright right
licking
now.
my giblets, I'd be like, I mean, my old boss, yeah, maybe it'd be okay because she's really hot, but so shouldn't say that. Should not say that. I've got a girlfriend. Good God, I'm gonna get told off.
That's going to have to get cut out.
Yeah, probably.
I'm not cutting it out. I'm not doing any edits this season.
Oh
You
no.
fucking are.
Oh god.
Jesus Christ, man! I have to get a job at some point. All right, a proper job, Marlon. Like one that actually pays me money. All right, then go on.
Where were we?
It's fine. I don't have a mortgage. Fuck it.
Oh.
So we've gone off point again.
Yeah.
Wait.
High five.
Right. Where
All right,
were
we're
we?
talking about urology. Your boss seeing your bits.
Oh,
She doesn't have cold hands, but you should have said that she did.
No,
Go
she
on.
does. No. But I think it's. I think it is scary being a patient. I think it's helpful having had that experience, just because it makes you a little bit more, empathetic to your patients.